Well, good afternoon, everyone, and welcome to the Police Protocols to Reduce Arrests of Young People in Your City webinar as part of the Municipal Leadership for Juvenile Justice Reform Initiative at the National League of Cities. We're really excited to have all of you here today. We're going to be running through a really exciting presentation with some very innovative police leaders in the country today. And the way that we're going to operate today is we're going to have a little bit of a presentation time, and then we'll allow you all to submit some questions. You can submit those using the question panel, which is in the gray box in your GoToWebinar format. And then we are going to be recording today's webinar, and we'll email it to everybody, even if you missed, even for those people who missed the webinars. If you're having some technical difficulties with the webinar, feel free to use the chat window. I can see that, and so I can try to help resolve any questions. Okay. So welcome. As I said, this is Laura Furr, the Program Manager for Justice Reform and Youth Engagement here at the National League of Cities. Today we're going to have two esteemed presenters. We have Deputy Commissioner Kevin Bethel from the Philadelphia Police Department, and we have Deputy Superintendent Michael Grotman from the Brookline Police Department. What we're going to do is run through just a little bit about the Municipal Leadership for Juvenile Justice Reform project here at NLC that we have. Then we're going to talk about the initiatives, the reforms that Deputy Commissioner Bethel and Deputy Superintendent Grotman have made in their various jurisdictions. We're going to talk a bit about some of the data trends that led to the creation of those things. We're going to talk about the program features that are intrinsic in the initiatives that they've created. We're going to talk about the current results that they've both seen, and then we're going to open it up to questions that I you all. So the Municipal Leadership for Juvenile Justice Reform Initiative here at NLC is supported by the John D. and Catherine C. McCarthy Foundation's Models for Change initiative. Models for Change is a network. It features a network of government leaders, policy experts, and a bunch of other organizations that you see around the side of this slide. The mission of Models for Change was to ensure that youth who make mistakes are held accountable and treated fairly through the juvenile justice process. It's been running for a decade now, and it's currently in its legacy phase, which means that they are ramping down the actual active services and active funding, and making sure that what the accomplishments that have been made through the initiative are disseminated to as broad a group as possible and carried through and remain active in jurisdictions across the country. Models for Change touched almost every other state while it was active, and continues to reach out to new states and new organizations across the country through things like this webinar. So our initiative here is really focused on engaging city leadership, mayors, city council members, the staff and directors of departments, including police departments. And we've found that cities can have a really crucial role in reforming the juvenile justice system, the youth that it sees, and the services that it provides. So one of the things that we've been working with cities to do is to build a robust continuum of community-based services that are high quality and measured. The other one is, and this is the focus of today's webinar, is working with law enforcement agencies to divert youth at the first interaction with police, and especially focusing there on youth of color to reduce the racial and ethnic disparities that exist throughout the juvenile justice system. And the final piece is, as youth come home from confinement and probation, or come off probation in the juvenile justice system, they're returning to communities within our cities. And so how can cities support their reconnection to school, work, family, and community? We've identified some very specific actual strategies within those things. So one is, it's something that is intrinsic in all reform efforts, is to collect, analyze, and share the data with system partners. We're going to be talking a good bit about data today, and that's a really crucial component of both the reform initiatives, but also as you go forward and try to implement these things, looking at the data in your own jurisdiction. And I think Superintendent Grotman is going to talk a good bit about how data was important to his efforts to craft the validated tool that he's going to be sharing with you all. Another really important piece that goes across all of these strategies is to convene partners and share existing stakeholder groups, or convene partners and stakeholder groups. And then we've sort of seen 3 actions that we really view as part of a potential continuum here that cities can do to decrease the number of youth going into the system and improve the sort of targeting of the system, the deep end system interventions towards youth who really need it. So first is diversion protocols at the first point of contact with police. We're going to talk about that more today. We've done other webinars on what we call juvenile assessment and service centers or other referral mechanisms. So encourage you to take a look at the other materials that we have on our website, which we'll have the link up later about that. And then also, what are you diverting these young people to? And so does your city have a robust continuum of high-quality community-based services that you can target for the right young people that are being diverted from police or even from further down in the system? So I want to first start us off with allowing Deputy Superintendent Grotman to introduce himself initially, and then also to start to talk with us about what data trends prompted you to institute your program.
Thank you, Laura. Can you hear me clearly?
Yes, we can. Thank you.
So my name is Michael Grotman. I'm the Deputy Superintendent here in Brookline, Massachusetts. Brookline, Massachusetts is surrounded on 7/9 of our border by the city of Boston and was once a part of the city and was incorporated away from it in the 1700s. For anyone who visits Boston, if they look at Fenway Park and look southwest, we're right there. We literally within a very short distance to Fenway Park. Brookline is a very homogeneous, wealthy community that surrounds some of the areas of Boston that are very affluent, for example, the Longwood Medical area, and some that aren't so affluent. So we do a lot of our work with the folks that we come across are often from the city of Boston. And what we did was we took a long look at the way we were dealing with juveniles. And this started many years ago, probably 6 years ago now, where we started to see the waste of resources was significant. And what a lot of people don't know is the number of available beds for juveniles who are detained, unless they're found a youthful offender in Massachusetts, is very, very limited. So for the area of Boston that we are in, there's only 6 beds each evening for juveniles who are detained in the Boston, Brookline, Cambridge area. That was difficult. Because these beds get filled up so quickly, and because we have to abide by the guidelines under the Juvenile Justice Act, we would end up having to send 2 police officers 50 miles to the next available alternative lockup facility, and that's Worcester, Massachusetts. We found this to be a tremendous waste of time, resources, manpower, and we needed to look at something else. So what we were doing would we send 2 officers actually out 50 miles to drop a child off, take the child through intake, drive all the way back, and then later in the shift, drive back out and drive back again, so 200 miles in one shift, so that the child would be at the next at court for the opening of the courts to be heard. And looking at that, it was very antiquated, to say the least. We also found that as we were looking at this, we found a lot of the kids that we dealt with, they seemed to actually be getting worse. So many of the kids that we arrested for minor offenses, it was their first offense, meaning they had never been arrested, or at least there was no record of them ever been arrested before. But after we arrested them, we started to see them a lot more. So from a administrative perspective, it appeared that we were actually making things worse. And lastly, the thing that we noticed the trend was that there was a significant overrepresentation of the kids from the city of Boston. And now Brookline is a very homogeneous community. Well, Boston, as everyone knows, has got a lot of colleges, very heterogeneous community, I'm sorry. And so we started to see disproportionate minority contact and confinement, and that was concerning to us. So based on that, we started to look at ways that we could change the paradigm, so to speak. We would just, it was time for us to look for a better way of doing things.
Great. Thank you, Michael. And so I want to also allow Deputy Commissioner Bethel to pick up now and introduce himself and talk a little bit about some of the data that they were looking at in Philadelphia that created the drive for him to create the diversion program that they have there.
All right, Laura and Heidi, thank you very much for the opportunity to speak. And so good afternoon, everyone. I'm Deputy Commissioner Kevin Bethel. I run the patrol operations for the city of Philadelphia. I've been at the job for 29 years. I oversee all the patrols, school police officers, school crossing, a few other things. And so about 4,000 of the men and women of 6,300 officers come under my charge. And so we really were looking at a hard look at our schools. And first, let me give you the backdrop of the city. We're about 140 square miles. We have 21 patrol districts. We're the fourth largest police department in the city and the fifth largest city in the United States and fourth largest police department. We have a very large school district system. We have the eighth largest school district in the nation, and with about 150,000 students, with 163 elementary schools, 63 middle schools, and 56 high schools. And so one of the things we started to take a look at when I took over the school district and took over the schools is clearly the number of arrests, and I'll talk in some later slides as to what specifically the program did. But first we started out looking at the data because we had some serious concerns about the number of arrests we were having in the system. And so as you look at this first slide, this represents the school year prior to us starting our program. The sheer number of not only the numbers of getting arrested, but the issue of disparity. Now we do have a system that's about 85% African American Latino, but even with those numbers, the number of kids getting arrested in the system is extremely high. We're arresting on average 1,600 kids a year. In years prior, in other administrations, other superintendents, we would do upwards of 2,000. And so as you look at the chart here, the number of African American males and females represent the lion's share of our numbers, and then followed by Hispanics, white, and then Asian has a very small sampling. And so this made us first and foremost recognize that not only did we have an issue of disproportionality, and the system is large in and of itself, but it was an area that we really had to take a hard look to see, what are the things we could do from the police department side that could really change the paradigm as it relates to arrest. And I'll get in more detail when we move into some of the other slides where we made that shift. But the data was important. We did though that we're only showing this one slide, we really drilled down to every school to see what the data looks like. And so when we drilled down, as we move into the second slide here, is that one of the things we recognized that of the 1,600 arrests we had a year, almost 60% of those arrests were for what we consider low-hanging offenses, summary or misdemeanor, low misdemeanor offenses. The biggest category, as depicted, was disorderly conduct. We knew that when you look at those numbers, and it was our biggest category where kids were fighting in the hallways, and the school district was consistently calling us to arrest those children based on disorderly conduct. The next offense that was one of the big categories for us was weapons. And again, we're not talking about a gun. In our system, and I know our system is different than many others, a 10-year-old child who walks into a school district with scissors will be considered a weapon, and that child will be arrested, taken back to our headquarters, fingerprinted, photographed, held in a cell block, in our case, a maximum of 6 hours. A parent, in most cases, and will come and get that child. The next day, that child would then go into and be sent back to the Juvenile Justice Center, where they would then meet with someone, and oftentimes that child would be released and go out into our youth aid panel and in the community. And so when we look at those, that was another big area. Drugs, particularly marijuana, was a big area, and trespassing. So when you just look at these four categories here, they represented a very large percentage of the offenses that our children in the system were getting arrested for. And the first-time offenders, most of our kids have never been arrested before. And so this was very telling for us as a department, where we had really not really drilled down well enough to see exactly what we were doing and what was the reason for the number of kids coming out, and then why are those kids in particular, were coming from our African American and Latino community. And as we drilled down, we even found even further that most of our kids that were getting arrested were within 2 miles of where they lived, and many of the issues that were coming into the school were issues that were happening in the community. So the data that you see here really set the backdrop for, first and foremost, where were the areas that we had a disproportionality, but more importantly, what areas could we really tailor our program around that we could have an immediate impact on what was going on. So as we move through the other slides, I'll share with you how we developed the program to be able to impact and use this data to drive our goals moving forward.
Yeah, great. Thank you so much. And so, as you all can hear, one of the key pieces here was to really look at the data at the front end and identify the really significant needs that were happening. And then now we're going to move into what both of these police leaders did in response to the need and the data that they were seeing. So we're going to go first to Deputy Superintendent Grotman and talk to us a little bit about the key features of your program. And who are the departments or the organizations that were involved in the setup? Collaboration is so important in these kinds of programs.
It is, and I want to congratulate. I had the honor of sitting on a national, actually international panel along with Morris Copeland. We all spoke about the need for this at different parts of the country, and of course Morris is down in Miami-Dade, and so a lot of us, we've talked a lot about this, and we spent a lot of time, as Kevin said, really just looking hard at the numbers and the trends. And what we found specifically was that we was, just like Kevin, far too many of the kids that we were sending into this system were low-level offenders that really didn't need to be there. The other thing we found, which again Kevin mentioned, was that a lot of these offenses were very minor offenses that were based on behavior, for example, disorderly. So when we drilled down, we found that most of our arrests were based on behavior and background, where the kid was from and how the kid was acting. We didn't think that was inappropriate. We thought, in fact, it was very arbitrary. So that was important. The other issue was that we wanted to stop sending these kids into a system that, at the time, and I believe there's data now that backs this up, it appeared we were making the kids worse. And it just didn't make sense to us. We had kids who would reoffend, and in the amount of time that it took for us to actually do the paperwork, these kids were back out on the streets literally because we were right beside the courthouse. So we found that kind of wasteful. And so what we did was we've been working on our police legitimacy and procedural justice for quite a long time, and that's important, especially in this community, a homogeneous community next to a city that's much more diverse. And so we wanted to make sure that we were doing was fair and equitable. The key to the procedural justice, the police legitimacy efforts, is unbiased decisions that are consistent and fair. And we were looking at a way that we could do something where there would be no questions about why we did it. At the time, I was assigned to the JDAI Massachusetts initiative, and over the number of months that I sat on the board, I kept hearing that the number of kids that they were having sent to them were low-level offenders that shouldn't be there in the first place. So after several months of this, it dawned on me, well, maybe we should be thinking about a screening instrument if everyone else is thinking about using it. Massachusetts was a little bit behind at the time. Places like New Jersey, Virginia, and other states do use screening tools, and that's what this whole idea was launched. So the other thing that was important was that we wanted to quantify this so that we can ensure that the commanding officers who were making these final decisions to process were all doing this in a structured environment, meaning the arbitrariness of the way these kids were coming in and the fact that many of these commanding officers simply just pushed them right through the system was not something that we thought was effective. The one apprehension, of course, that we did have was no one likes to unarrest a child. But in Massachusetts, there are statutes that allow for this type of diversion post-detention. So, again, it was a lot of work. I think the thing that I was most pleased with was collaborating with the others. And of course, I did speak at Kevin and Morris, but also we were lucky enough to partner with several departments in this area, as well as the University of Massachusetts Medical School. And I want to point out that we were helped all the way by a scientist named Dr. Gina Vincent, who is one of the foremost experts on risk assessment in the country. And it opened my eyes up about what we could do. When you've been in law enforcement as long as Kevin and I, what you think you're doing is very simple. But when a scientist looks at it and asks these questions that we just wouldn't think of, it changes the perspective of the way you're approaching things. So along with the Chelsea Police Department, the Mass Bay Transit Authority Police Department, and the Framingham Police Department, we went from a pilot study, which took us 2 years here to do, and then partnering with UMass Medical School, we went and collected data on over 500 kids on their arrests, and then went and tracked them. And we would not have been able to do this had it not been for the help of higher ed, and I cannot stress that enough. Of course, the National League of Cities and the ICP was with us lockstep too. And I think the partnerships that you spoke about were so critical in this. And I mean, it's led to this webinar and of course the release of this tool. But this is something that can really make a difference in law enforcement.
Thanks, Michael. And great. So want to now give a chance for Kevin Bethel to give us an idea of the key features of his program and the departments and organizations that were involved there.
All right. Well, thank you again. And so as we talked earlier, when I outlined, we use the data to determine, what types of crimes we were going to address and the sheer percentage. And what we decided, and I'll talk about the collaborative partners in a minute, in a few slides later, but that we were going to change the way we managed how we dealt with our students. And Mike just touched on so many very good points, and as we became more informed of what was going on, we realized that, we all agreed that what was the best interest of the students, and how could we use our tools and the things we had to change the way we were doing that and work with the supportive services to address these delinquent acts. So as you see outlined here, these offenses here were the core of the majority, or not the majority, but more than 50, almost 60% of our cases: possession with a weapon in school. And we had a number of the kids who were coming into the school with scissors and other cutting instruments. And one of the things we would find later on as we begin to get to the why and the what with them is they were oftentimes our kids were walking through some very difficult neighborhoods. Carrying a weapon to them had absolutely nothing to do with going to school and everything to do with getting into the neighborhood and getting into the block. Carrying a pepper spray because they were fearful that someone would be coming behind them, a parent who unwittingly gave them something that they didn't just know and didn't know that. Kids who were getting locked up for trespassing, coming into our schools that they should not have been in from another school. And then disorderly conduct, as I indicated earlier, was one of our big drivers. It really was, the school district had, unfortunately, through the loss of support services in many of my schools, just due to the sheer lack of funding, do not even have a vice principal. And so oftentimes it's the principal and the child and my school officers inside the school. I just want to clarify something. We have a system where we have officers, school safety officers. They are not sworn officers. They do not wear weapons. We support those officers with sworn officers who are sworn, who work within the patrol districts and come to the area to support the schools in their area of charge. So none of our officers, we have no uniform sworn officers who wear guns in our schools. But again, because of that and because of the fact that there was lack of support, the district has started relying on using arrests as a way to manage their behavior in the schools and have my officers come oftentimes to take those kids out of school to be arrested. And it goes on obstruction of highway and possession, knowingly and possessing of a controlled substance. Most of the kids in our system were carrying marijuana. We come now to learn that many of our kids, and I'll talk about what we're doing with the kids behind the scenes, are self-medicating. Many of our kids are smoking and taking marijuana because of the trauma that they deal with at home, and take that and they use that as their medication. It's unfortunate But as Mike said, as we became to understand more about what was going on with our young people and better educated, we started to learn that, hey, what I used to think was just kids didn't know any better, only to come to find out that, that was using marijuana to do that. And so these were our designated delinquent acts. As you see, many of them were victimless crimes, so we didn't go after issues around victims as we created our diversionary tool. So if you go into the next slide, ultimately here was our goal. Our goal was to address the school-to-prison pipeline by diverting first-time offenders. So, what we are doing, and you'll see in the next slide as I go through before we move on, but we were looking at the first-time offender. Most of the kids through our analysis and the data were first-time offenders. Our program is not at this point available to a child who's already in the system. We can refer them and let their probation but know about what's going on, but our program is not for those kids at this point. But what we have done is with those kids, we instead of pre-arrest, we have a pre-arrest program, which I'll kind of explain in the next slide, where we do not do paperwork for the child, and we move them into intensive preventive services. And as you see outlined here, and I'll talk about it more in a minute, we improve, the whole goal of our program is to move children and students into preventive services to help them with their school performance. They work with their youth and families. They help the family relationship. They enhance their life and social skills. And so if you go into the next slide, I'll really kind of break it out into detail what happens. And so first, we partnered with the Department of Human Services, and I'll talk more about all the collaborating partners, but highlight the Department of Human Services now. They have been our key partner in this process to provide the services needed to conduct our program. And so what you'll see if you're looking in the right, we decided that in lieu of that arresting that 10-year-old child that I talked about earlier, we would do something totally different with him or her. And so when my officers arrived at the school today, where they used to would arrest that child for one of the offenses that I outlined, we created an intake center at the Juvenile Justice Center. So we have 2 officers who are working with Juvenile Justice, with the Juvenile Justice Center, with 2 social workers. We have a center, no kid or parent allowed to come to that center. It's just a working office. My officers who arrive, I have 84 sworn officers who support the program, who will help with the school officers, non-sworn in the school, which is 320. They arrive at the school. They have that 10-year-old child that we talked about. They'll call into the intake center, determine whether that child has a record or not. Once it's determined that the child does not have a record, they are given a letter to the child and the parent to inform them that within 72 hours, a DHS worker is going to come to their residence, and they're going to do a home assessment with that child and with that family to see what their needs are. One of the things, my officers will oftentimes accompany them. We are finding all those things, and I'm sure everyone who's listening, the things that we know are going on in these houses, we're finding. Lack of bedding, lack of heat, lack of electric, lack of food. And so DHS is now working with those families in many cases to get them the support services they need. There's an initial assessment there. The program is explained to the parents and the child. Now here's something that may give many people pause. They're given a choice. They have a choice to continue in the program. During that conversation with the child and the parent, they're given a collateral consequences conversation about what could have happened had they been arrested. They're advised on what the program can provide for those families and what they can do for them. They can opt out. If they opt out, then they're told that they will not be eligible for the program ever again in the future, and my officers, when they do opt out, will go back to the house and try to convince the parents or the family how important the program can be. We have about 90% of the families participate, but one of the things we find that by having a choice, they're more willing to get involved in the program and do all the things necessary. Those children then move into a program, and they will spend 30, 60, 90 days in a program where they will work with them and those kids to any of the issues that they may have that they are concerned to them, working with them on their homework, working with them on their family support service, working them on the parental skills, those things that we feel can help that child to be a better student, to be a better person, and to help them move forward without using arrest to do that. We do not do arrest paperwork for any of the students that we divert we felt that was an important part of our commitment to work with the kids in a different way. And we move on, we move through the process. They'll spend upward of 90 days in the program. And at this point, we've diverted close to 750 students. At this point, we've only had 6 kids. We started May of last year. We've only had 6 kids who have returned, who reoffended. So our percentages is a little over 1%. We're actually less than 1% now of the kids have returned. So the recidivism rate from our kids is going extremely well. And so if you go to if you move on to the next slide, you'll see our collaborating partners. And you heard me highlight Department of Human Services, and we could have not done this program without the Department of Human Services. We're working with existing programs that they already had, that the court was using, that was on the post side of the program. We felt that we wanted, as a police department, to be able to have those things pre. And oftentimes when we arrest a child, we can get wraparound services and all kinds of services, but without an arrest, those services weren't available to. Well, now those services are available to us to be able to divert those children, and DHS, our Department of Human Services, has done a phenomenal job in supporting us in doing that. Drexel University was fortunate enough to get a grant from the Office of Juvenile Justice Prevention. That grant now has allowed us to bring on an academic partner. Drexel will be evaluating the program over the next 3 years and to determine, is the program successful? It's easy for me to say the police department is a success, and you heard Mike talk about that earlier, bringing on a university to really say that the work we're doing is effective, particularly since we're not using the traditional stick to do that, and having the same success hopefully will open eyes to others. And then you'll see some of our other partners on here. The school district has been a great partner. They agreed with the work we're doing. Dr. Hyde, our superintendent, has been putting a lot of restorative practices into play, and Rachel Holtzman and Jody over there working there with the school discipline have been a great partner. The school, Philadelphia District Attorney's Office, George Mosley, who again worked with me to make me understand that diversion was a police process, that we needed to take responsibility for that, that we had the controls to not charge kids if we so desired, and really helped us to understand how to be able to frame that. And you heard Mike talk about the JDAI collaborative. I was part of the JDAI collaborative with the city here. I was able to, fortunately as a result, fold what we're doing in the program and get the support from the key stakeholders, because the collaborative was already set and they had a DMC subcommittee. I walked into the DMC subcommittee where I had the deputy commissioner from the Department of Human Services there, the deputy commissioner from the district attorney was there. So I had those key stakeholders there to be able to make some high-level decisions about what we're going to do with the program and help facilitate. So that really went well. And oftentimes people look at the bottom right, and they say the Defender Association. Rhonda McKitton, who's part of the collaboration, well, why would you have the defenders? There's no one more a stronger advocate for the kids than the Juvenile Defenders Association. And things that I was asking, the questions that I was asking, were not really being oftentimes addressed. For example, we were going to do first-time offenders. If I left that as a blanket statement, we would move on. The Defender Association and Rhonda comes back and said, well, what if a kid was found not guilty, or his case was withdrawn? Would he or she be eligible? Well, yes, because by definition they don't have a record and it's their first time offense, they will be eligible. So we were able to capture that in. And so all the collaborating partners you see outlined here are folks who really have worked with us. In the next slide, you'll see our service providers, and this is where we find the best context. We have 6 providers are situated. We have 6 patrol divisions across the city. Each one of these the service providers are in one of our patrol divisions. So a child who's moving across the system, if he lives in one part of the city and he gets in trouble in a school in the northeast part of the city, but lives in the southern part of the city, he will go to his provider in the neighborhood that he lives. And so these providers are all come under the umbrella of the Department of Human Services. This was a group of individuals and groups that do the intensive preventive services for us. And they're doing such a great job. 2 of the programs here, CORE at the top and the Bridge at the bottom, also have drug and alcohol treatment services for juveniles. So we are now getting those kids with marijuana uses we find may have addictive issues. We are, though it's not part of our original MOU, diverting young people. If we get a young child, last week we had a 15-year-old child with heroin who may have an addiction issue. That us is not an arrest issue. We want that child moved over to services. And so we have a very strong team here. These programs were part of existing services. We've not had to add any additional money or funding into the service providers because they were part of the infrastructure of DHS. And so we really feel confident that we've created a very strong panel, a strong collaboration, both those on the front end side of the system are working, but more importantly, the service providers, and really create a product where we're working with young people to deal with the trauma that they have. And we're really finding that many of our kids are suffering from some significant trauma at home. Divorced parents, addicted parents, no parenting, grandmothers taking care of them, and we feel confident that we're in a direction now that not only makes to help these children, because I've often told people, what is it like? For years, my office has been arresting these kids and never asked why. Ever asked that child, are you being sexually abused? Are you being physically abused? Are the things that are going home that are contributing to your behavior here? We never asked those questions, and I can tell you my 84 officers who administrated this program have been the greatest ambassadors for working with these kids and really starting to see the benefits of what they're doing for these kids. And I will stop there.
Great, thank you so much. Yeah, and we're very excited to be able to present two different diversion programs that happen at two different points in the arrest process. Of course, the school-based diversion program that is happening now in Philadelphia occurs in the community, in the school. The young person is not removed from the school if they are divertible. And then the program up in Brookline is happening at the precinct, which I think is interesting, the amount of questions, the amount of time you're able to spend in making that decision. And wanted to, Michael, if you could for a second, just give us a couple of the questions, talk about the tool itself, the MASTLE itself. How many questions are asked on it, and give us a couple of examples of the questions that you ask on the tool.
Sure. After listening to Kevin, I wanted to say, okay, this is over, because he covered everything. And again, Morris and Kevin and I were lucky enough to, under the IACP, to work together. And it really, what we have done here is just to make sure that the system that we put in place is something that's objective and impartial, and of course accurate. And that's where the higher ed came in. But what it does is it allows the commanding officer, once the juvenile comes into the station, to determine whether the juvenile is likely to reoffend or fail to reappear. And this is done through we call it a tool because it's not in the sciences. An assessment refers to a much more in-depth tool. That's not the right word, but anyhow, a checklist, you go down a checklist, you fill out all the forms, fill out all the boxes, and what you need is some background information on the child. The MASTLE itself is very similar. It takes a similar approach as the way Kevin has approaches down in Philadelphia, in that we're looking for more of a public health approach now when we're dealing with these kids. The public safety approach obviously has not worked. It's only made things worse. So, if, for example, in the MASTLE, there's two separate scales for failure to appear and two separate scales for risk of rearrest. It may sound complex, but it's not. And how it's done is you look at the kids' past behaviors, including criminal record, and you try to identify if there are any open warrants, or if they're currently on probation, if the offense they committed was violent, and then it's coded and weighted. And it's very, very simple. In fact, when I was teaching the supervisors here, it would take 5 to 10 minutes to teach the whole thing. The write-up on it is very comprehensive, so you can understand, and that was done by Dr. Vincent. But the second part of each scale has to do with additional considerations, and this is the public health approach that I'm referring to, as well as Kevin when he was talking about the old traditional measures that we were using. We know that law enforcement, when you have a kid with a problem, it is likely, highly likely, that it originated in the home. And whether it's substance abuse of the family or any other thing, we want to make sure that we take that into account when we're dealing with these kids, so we can get them the help they need if the parents haven't done that. Each part of the tool, there's a second scale called additional considerations. Now, one thing, for example, that the extensive examinations throughout the country have done is they've looked at why kids default. I never would have thought of this, but Dr. Vincent had study after study indicating that one of the key reasons was they didn't have access to proper transportation, reliable transportation. We would have never thought about that in law enforcement, but that is something that is taken into consideration in this tool. Additionally, the poor parental monitoring involvement, that's not something we ever concerned ourselves with. In fact, we expected that. But there's a lot of cases where kids were just getting into trouble and mouthing off because they were showing off to their friends. Another issue is substance abuse, and not just necessarily, not necessarily the child at the time of the incident, but did the child have a substance abuse problem like the 15-year-old in Philadelphia? Did the parents have some type of substance abuse issues that are affecting their care ability for the child? So these are things that are built into this scale that are really outside of what we normally used, and that made a big difference. So the importance of the scale is that it's generalizable, meaning this scale you can take it to other areas of the country and it applies, and that there's things like the age of first delinquency of arraignment that's very, very important, prior delinquency arrangements, things like that. The scale that we set was based on specific to a Boston, the cutoff score, was based on kids from the Boston immediate inner urban and urban Boston area. So, for example, if you took it to Philadelphia, it would be, the cutoff scores might be different. It might be higher or lower, likely because of the crime rates, it might be a little higher, a little lower. But that being said, these are all variables that we know based on science now that predicts whether or not a kid will reoffend and if they will appear or not appear for court. Now, if they're not going to reoffend and they're not going to default, they're not going to fail to appear, then why would we put them to a system that makes them worse anyhow? And so really that's the thing that we're talking about. The two scales, of course, that I just spoke of are an actuarial scale and a professional judgment scale. Even taking all these weighted and accurate scales into consideration, we still have the final conclusion of professional judgment of the police officer who's in charge of the shift at the time. And that's important because there may be something that is in the tool that we have missed, that we haven't screened properly for. And it may be something that's not too unique, but again, it allows them, he or she, I don't think this kid should go into the system regardless if the scale is high, or I think this kid should go into the system if the scale is low. If they do that, right in it, they're required to write what factors were taken into consideration if it differs from the cutoff scores. So it's a great way for us to be able to, again, have a structured decision-making process for clear oversight, and it also gives the officers and the supervisors confidence that the people that they're either arresting or diverting are the proper people. And that's really what the whole process was about, to make sure we get the right kids to the right place for the right reasons.
Great, Michael. Thank you so much for that. So one quick opportunity for you to give us a little bit of information about the results that you've had thus far with the implementation of the tool in this early phase, and other jurisdictions that have expressed interest in adopting.
Sure. Actually, it's been great. And we were lucky enough to form a partnership with Boston, who we're very close with, who's actually a butt, and the city of Cambridge, so the kids that we divert are getting the help. That was our biggest concern in holding up the implementation of this was we did not have the services in place, for example, like Philadelphia, where if we did divert a child, especially one who wasn't a resident of our town, but was a resident of the city of Boston or Cambridge, that once we diverted them, they would get the proper screening and assistance that they needed. And we were fearful if we did that, it would, there would be liability issues, and it would be the worst thing that we could do for a kid. We wanted to make sure there was follow-up. We've already had several police departments throughout the country adopt this. We've had multiple inquiries on it. It's going to take time because it's really just coming out, but it's really another way to ensure the public that we're doing things evenly, fairly, and consistently, and we're doing what's right for the best interest of the kids.
Great. Yeah, thank you so much. And so, Philadelphia has been implementing their diversion program for a bit longer than Brookline, so wanted to give Kevin a bit more opportunity to discuss some of the results that they've seen.
So, listen, the results have been remarkable. I think we went into the process with a 3-year 50% reduction goal, and we hit the mark coming out the blocks. All the, we talked about the earlier data and the areas that we were looking at. So a couple of things happened. As you see on the board, on the screen, the 54% reduction in the first year, of implementing the program. Of that 724, about 400, a little over 400 of those kids were diverted through the program. And what was really was great was that the school district represented a 300 reduction where they just stopped calling us. Early in the process, I met with the principals and administrators and talked about, that we could no longer be their disciplinarian. And it wasn't an adversarial conversation. It was just really informing them that, we couldn't no longer be the one to take those 10-year-old children out or any of those children out of there and arrest them in the manner that we were arresting them. And I was surprised and shocked at how quickly they started to respond to that and help with those reductions. So across the board, between the work of the school district and the administrators at their school, as well as the diversion, we were able to drop significantly, and was more, and in those areas, and that's why I appreciate, when you talk about using the data drove this, and so we had an 87% reduction in our weapon offenses, 85% reduction in our marijuana arrest, 77% reduction in our disorderly conduct. And if I could take a moment, one of the things we also did was implement, prior to even implementing the diversion, we made a very strong statement within the school district under my charge and the chief, Carl Holmes, who runs the school district for me, that we would no longer allow our school officers, non-sworn officers, safety officers in those classrooms for code of conduct issues. We were finding that many of our officers were involved, would get assaulted or get into fights with the students, or not fights, but altercations with the students, which resulted in them being arrested for assault. We recognize that no one of our officers would be going into school classrooms for code of conduct issues. Kevin wants to sit there with his headphones on. That's not a policing issue. That's not a school safety issue. That's a code of conduct issue that should be addressed by the courts. By the school. And so we started to receive the reduction in our school officers being assaulted. And so, and then the issue of disparity. 90% of the kids who are being diverted are African American. Now, I'll be very honest with you. Our numbers that relates to disparity has not changed, and Laura, you heard me say this more than a few times. Unless I went into my school district and locked up every white child in the system, that number was not going to change. But what is changing is the sheer number. 800 and something students, of which 90% of them have been African American, first-time offenders, not being arrested, with only 6 of them coming back so far, a little over a year, well past a year now. We feel that this is a very, very good opportunity to really have and address the issue of disparity, but more importantly, the issue of recidivism and these young people, constantly coming back into the system. And so as we come out the blocks, and now we're into a new school year, we're 3 months into the school year, and I'm just so glad to report that we're now over 50% reduction in the numbers of last year. And so if we continue the trend that we're on now, staying above the 50% mark, as you see that number of 724, we believe that we're going to be able to cut that number in half and have anywhere from 350 to maybe 375 kids arrested this school year for 2015-2016 for a school district that in most cases was locking up almost 1,600 kids. And so as you can see, I mean, it can be done, and it can be done. And so I'm just very thankful and really appreciate the work that, Mike, you guys are doing as well, because it is all our way to really change the dynamics, the paradigm of what we've been doing in policing.
Yes.
Yeah,
yes.
so such an inspiring result, and thank you so much, both of you, for taking the time to share these with us today. We want to open it up for questions from everybody, and so you have a question panel in your GoToWebinar gray box that you can use to submit questions. Please feel free to do that. And I wanted to start off with a question for both of you about how you worked with officers to get them on board with the new initiative that you were using. And either one of you, if you want to take it first, and we've got about
Kevin, do you
5
mind
minutes for questions here.
I'll answer this very quickly, and then Kevin can expand on it. But anytime you tell an officer that they don't need to do paperwork, arrest paperwork, they're usually receptive to that. And because of the review process that we normally go through, it actually helped them because they knew they were arresting these kids or not arresting and diverting these kids, and they knew they had science behind them telling this. So there was not sometimes when an arrest that was questionable, that's decreased significantly because they have the science to say, no, this kid should have been arrested or this kid should have been diverted. So it's been very positive. I'm sure Kevin can expand on that.
And so, yeah, I feel just like Mike in using the data to inform them, but we also really built a program from the bottom up. And, I created a panel of my officers, school and non-sworn officers, and really sat in a room and really discussed with them what our goals were, what we were trying to do, and what we were going to be able to provide them as instead of going into the school with a set of handcuffs, they were the first time to be able to go in that school and provide services. And I can't tell you if they are the greatest ambassadors I've ever met. I mean, can you imagine what it's like for for people to go, officers that have to take young people out of a school knowing that they have a troubled background, knowing that they wanted and not ever have another alternative. And I'll tell you a quick example. We met in April. We talked about the program. They walked out of the room, and by day 2, they were calling me, when are you going to start that program? They hit us so much. For the next 30 days, they kept calling and calling because they were just tired of the vicious cycle that they saw. And so we went into the program. We started with a cell phone, a scratch pad, and sitting on a carpet. We didn't have a desk, and said, let's go. And we did all the 142 schools, the parochial schools, charter schools were be able to participate in the program. And they're just getting the reaps. One of the officers grabbed me the other day and said, hey, Deputy, one of the young ladies just came back up to school and sought me out. She's back on a spring break she's at Spelman. She got a full scholarship to Spelman, but she was a child who was diverted. And she found him out. She didn't have his number. She said, I look up, and here's this girl. She come up and give me the big hug and came back to thank him because he had diverted her the year prior. She was able to get counseling. She was able to continue her studies and was doing so well. She got a scholarship to go, 4-year scholarship. Can you imagine what that cop, you should have seen the smile on his face. And that's the stuff that I tell people, you really, really can't take away how it makes my officers feel. So they have really, really bought into a process because they know for the first time they're not the Grim Reaper coming to school. There's someone who can be respected. And I think no matter what happens, that child who goes on in life is always going to see policing from a very positive perspective. And I think that's a thing that's going to really change how these young people view us as they go into adulthood.
Yeah, I can't think of a better story than that to really represent what's been going on. I think it's such an important example of sort of what's on the line here for these young people, and a charge and the impact that it can have on their college acceptance and scholarship, and going forward in their lives, and the removal of that from their record is so crucial.
And Laura, too, I think the other thing is that it also helps the police officer become less of the, as Kevin said, this individual, the Grim Reaper. They start to look at police officers as resources again, which is what everyone signed up for in the first place. Yep. And so those type of great results where you get a kid to go to a 4-year great college, those are the type of things that can help everybody, because that's really what everyone signed up for. No one signed up to arrest kids. They signed up to help people, and you know, it's a win-win doing these types of programs.
Yeah, thank you both so much for the time today, and I want to make sure that everybody has access to some additional information and resources to help get you started. So there's a number of links on here, and when we send out the recording, you'll be able to click on those in addition to clicking on them now, I think. National League of Cities has produced a number of 2 pieces of an information brief about alternatives to arrest that highlight both of these options, as well as our municipal action guide, which is a bit of a broader picture of the city opportunities for leadership in juvenile justice reform. I want to make sure to point out to you that the last link on this screen is to the NISAP, which is Michael referred to Dr. Gina Vincent, who works at the University of Massachusetts Med School. She also works at NISAP, which is the, I think, National Youth Screening and Assessment something. I forget what that stands for. Sorry about the acronym. Partners. Okay, thanks.
Yes.
And that's where you can actually access the MASTLE itself. They ask, they're asking for registration for the tool, as well as just so you can receive some ongoing follow-up and support from the University of Massachusetts itself, especially as Michael was talking about, that validation of the scoring level is crucially important for a particular local law enforcement agency to do for itself. And so that's something that you learn about via the information and the tools that are available at NISAP. So I want to make sure to point that out for you all. And also want to give you an opportunity for anyone out there who wants some additional information, wants to connect with Michael or Kevin, especially as Kevin, you want to share your news?
You can share it. You can share it for me.
So he will no longer be Deputy Commissioner at the Philadelphia Police Department, but will become a Stoneleigh Fellow, sharing this information and working on diversion at the point of arrest across the country. So we're very excited to have him begin doing that across the country.
Well,
thank you. 14 days ago and counting. Thank you, Mike.
And we'll be able to, continue to follow up with him. And so if you would like to connect with either of them, or get, additional information about how National League of Cities can support your efforts to reform juvenile justice at the city level, please feel free to contact any of us on that screen right there. And thank you all so much for taking time this afternoon. We've had a really fantastic hour together. I hope you all have a happy new year. And we'll all continue to do this work, and I'm so glad that we were able to make time with Michael and Kevin today. So thanks, everybody.
Thank you.
Thank you very much.
Same to you.
Take care.